Hi there, welcome back. This is Dr. Bamonte again, and we are going to dive into a kind of heated topic again because you know me, I like being non-traditional. We're going to talk about grain-free diets. Not the first time I'm talking about it, but I want to talk about a more recent journal article that came out and how it affects you, your pets, and your thinking. Because there's a conversation out there, is grain-free good? Is it bad? Are the peas the culprit? What does the latest research say? So there was a big prospective study that was done for 18 months, and it was published in the Journal of Animal Science in 2025. And so if you are a dog owner wondering whether grain-free is all about marketing or there is truth to it regarding your pet's health, or is it a bold just claim, I want you to stick around because you know me, we will talk non-traditional, we'll talk integratively, we will kind of challenge the status quo. We don't do cookie cutter around here because it's not just grain versus non-grain. It's about ingredient quality, processing, microbiome, heart health, and the links with it, and what that all means for your pet's longevity, for your dog's health and happiness. So I also want to invite you right now to go back to listen to episode 1, where I talk about grain free and if it's a scam. So this is more of a continuation of that conversation. And a little kind of brief history for you. Back in 2018, the FDA came out and issued an update regarding grain-free diets and the possible association between grain-free diets, especially those heavy in peas and legumes, in dilated cardiomyopathy in dogs, which is a form of heart failure where the heart gets really big and really can't contract very well. And that's because some dogs were developing heart muscle weakness. They were showing signs of heart failure. They had a taurine deficiency in amino acid. They had large heart valves, and many of these dogs had been on grain-free or boutique diets with peas or certain types of potatoes high on the ingredient list. And because of this, grain-free became a suspect in a diet pattern. It became a question on, is this causing this form of dilated cardiomyopathy? What is going on here? What is the link? But I want there to be some caution because subsequent research has shown that there's conflicting results now. The issue appears more complex in grain-free versus not grain-free, and grain-free is bad versus grain-inclusive is good. It's all about the ingredients and how they interact, how the diets are formulated, the processing, the breed risk, what's the taurine status of this dog, what's the gut microbiome status of this dog. That's what needs to be evaluated. And so in this study, it was about different carbohydrate sources in dog foods that supported overall health and cardiac function. It was an 18-month prospective study in healthy adult dogs. And this article was published in January 2025 in the Journal of Animal Science. And I will link this journal article below. And so this study was of 60 healthy adult dogs, and they were randomly put into 4 categories of dog food over 18 months. First was grain-free plus potatoes or peas and peas. The second was grain inclusive with peas. The third was grain inclusive without peas. And the fourth was a grain-free diet with just potatoes, no peas. So 4 different diets. The outcome was determined that they looked at echocardiograms, so an ultrasound of the heart to look at the valve size, the output of the heart, cardiac biomarkers via blood, like proBNP, troponin, taurine levels from blood, bile acids, urinary taurine levels. And what they found was there was no clinically significant changes in cardiac biomarkers or taurine status across diets. So they determined that they couldn't really tell a difference. Now, some of these dogs did have their fecal bile acids varied. Some were high on the dogs that were fed peas, a pea-rich diet, but it wasn't terribly clear on what the implication was for them. So the bottom line of this study showed that healthy dogs fed a well-formulated food with intention, whether it is with grains or without grains, meaning with peas or without peas, maintain good cardiac health over 18 months. And so the authors noted that only one formulation was per category, and these dogs were healthy to start. So 60 dogs may not detect every rare subclinical issue that comes about or changes that may apply, but is a really good source of us to kind of help pause and really think deeper about what we are feeding our pets rather than hanging on a few words or marketing claims or fear mongering. And so the good news is if you are feeding your pet, your dog, a high quality, grain free, or even grain inclusive diet that is well formulated, has adequate amino acids and protein and taurine precursors and digestibility and how it is formulated being less processed, that there's no major flags in their health, at least in the first 18 months. And maybe possibly overall. And it doesn't mean all grain free diets are safe. I want to say that in every case. Formulation still matters. The processing matters. The ingredients matters. How balanced they are matters. So I wouldn't be so inclined to grab it because it says grain free or grain inclusive. The ingredient list matters. Where are these ingredients in the ingredient list? Are they high up? Are they early in the list? Are they replacing good carbs and digestible protein? Are we leaning on them to be ingredients to fill, or are we using them responsibly in the ingredient list? Protein, amino acids, taurine precursors like cysteine still matter. Even though in this study, taurine status was unaffected, and other reports dogs with DCM have had low taurine levels. Maybe you've heard that. I've had pet owners come to me and worried about the taurine levels. I understand. The processing and digestibility also has to be looked at with these food. How is the food made? How digestible are the ingredients in it? Are they less studied or are they critically useful? Breeds, as we know, some breeds are just predisposed to DCM or taurine deficiencies. So this marketing grain-free that is inherently better or not, depending on who you talk to, is flawed because the word grain-free doesn't guarantee you superior nutrition. It's about a marketing label. Like what's in the food? How is the food being made? What else is in this food? Is it packed with other inflammatory ingredients? So rather than a default, grain-free is good, grain is bad, or grain-free is bad, grain is good, ask, is this diet well formulated with intention to be digestible? Is it biologically appropriate for this pet? Rather than grain-free, not grain-free. Is it highly processed? What's the carb content? What's the fat content? Because when I see a dog that has dietary risks, maybe they a history of poor food, multiple processed treats, they're eating a lot of legumes, they're overweight, they have skin issues, I want to lean towards a diet that is going to help set them up for success, whether it's grain-free or not grain-free. Getting less processed, less inflammatory ingredients, more biologically appropriate. Yes, we can monitor biomarkers if we need to and test their taurine levels and do x-rays and listen to their heart. But let's take a food audit. Let's look at the ingredient list. How much protein is in there? Where is protein? Is it coming from animal or plant sources? Is it a byproduct? Is it a meal? Where is it coming from? The treats and the extras are we getting? Are we doing table scraps that are healthy foods? Are we doing junk foods? Are we doing highly processed foods? What are those treats made out of? The history of how they've been eating. Have they had a diet change recently? What was the previous food? Was it low quality or better quality? Are there other combined risks? Poor food, they're inactive, they're overweight, they have a predisposition that commonly gets DCM. Looking at their lifestyle. Nutrition is such an important part of their health, right? It's the one thing that we do for them every single day. But other pillars are really important. Walking and enrichment, their weight, their mental stability, their nervous system, inflammation that can show up as ear issues, skin issues, poop issues. What's the health of their microbiome, their fiber digestion, the stress in their environment, the chemicals used in their environment. So for dogs, using only diet to assess the risk factors is important, but we have to look at other things, other aspects of their health, maybe doing other tests. So we don't need to be fixated on it has to be grain-free or grain inclusive, but rather it needs to be high quality. It needs to be balanced. It needs to be biologically appropriate. It needs to be pro anti-inflammatory, with the ingredients, the oils used, the carb sources, how much carbs are in there, what's the fat source. So if your dog is healthy and on a well-formulated diet, whether it is grain-free or grain inclusive, keep doing what you're doing. Check the whole diet quality, not just a few words. If your dog is on a diet that is heavy in peas and legumes and potatoes, and you notice any signs of them being tired or exercise intolerance or just something isn't right, talk to your vet. Have them seen, have them review the food and see if there's anything in there of concern, like truly, not just a quick glance and moving on. Maybe have some of these cardiac markers checked. Periodically do diet checkups. Look at the ingredients. Ingredients change. A CEO changes, and man, a whole company can change. Assess their body condition, their coat. Does it still match what you're feeding them, match for the life stage that they're in? Use your pet's longevity as a goal, not as a marker, not just avoiding big problems, not just while they're old. Use it as a goal that you are optimizing their nutrition for better and more years. It can be a lever in their health, absolutely. If you're unsure about what you're feeding your dog's diet or you don't feel like you have been heard, I want to invite you to schedule your one-on-one nutrition consultation. Bring the information of what you're feeding, bring the ingredient list. We'll walk through it. Not just because it says grain free or not, or complete and balanced, but looking at ingredients in your pet's health. Because grain free isn't inherently bad, but grain inclusion isn't inherently healthy and enough. Quality formulation, biologically appropriate, dog and pet individuality, lifestyle matter so much. It's a big piece of the pie, but it is not the whole pie. I'm here to help you cut through the noise. There's a lot of marketing noise. I want you to feel heard and seen when it comes to your pet's nutrition because it absolutely affects their longevity. So if you want an audit on their food or you're confused because there is so much noise out there, I want to invite you to schedule your one-on-one nutrition consultation. We will take a deeper look in a safe place, whether you're feeding kibble or raw or home cooked or combination or fresh food, and what is truly best for your dog, for their current health and their future health and their lifestyle. Thanks for tuning in. Here's to making smarter choices for our pets so they can live better, so hopefully they can live longer.